what exactly is a neurointerventional and how is it different from open surgery? నెక్ పెయిన్ కానీ బ్యాక్ పెయిన్ వచ్చింది అనుకున్నప్పుడు ఇది నార్మల్ కాదు, దిస్ ఈస్ అ రెడ్ ఫ్లాగ్ ఎమర్జెన్సీ అని అనుకోవాలి.
నెక్లో యూ హ్యావ్ నర్వ్స్, యూ హ్యావ్ బోన్, యూ హ్యావ్ మసిల్, యూ హ్యావ్ అదర్ ఫ్యాట్ టిష్యూస్. సో ఎనీ ఆఫ్ దీస్ థింగ్స్ కెన్
క్రాష్ డైట్స్ కూడా ఫాలో అవుతారు.
అవును.
సో అది నిజంగా హెల్ప్ అవుతుందా?
స్ట్రిక్ట్లీ టెల్ మై పేషెంట్స్ క్రాష్ డైట్స్ ఆర్ ఎనీ సడన్గా you're from eating salads, boiled vegetables and soups and green teas, you are definitely going to get in trouble.
జిమ్కి వెళ్ళే వాళ్ళు చాలా మంది ప్రోటీన్ ఇంటేక్ చాలా వరకు తీసుకుంటారు. సమ్వేర్ ఫైబర్ లాస్ ఉంటుంది, దానివల్ల దే హ్యావ్ కాన్స్టిపేషన్, సమ్ ఆఫ్ ది
యాక్నే ప్రాబ్లం అవుతుంది, కాన్స్టిపేషన్, గ్యాస్ట్రైటిస్ అవుతుంది.
జిమ్కి వెళ్తున్నా నేను అయినా హెల్తీగా ఉండట్లేదు. అన్నీ హెల్దీయే, కాకపోతే ఏది కరెక్ట్గా ప్రాపర్గా ఎంత క్వాంటిటీలో తినాలి.
ఇఫ్ యూర్ హ్యావింగ్ ఎ బ్యాలెన్స్డ్ డైట్, వెజ్, నాన్ వెజ్, వాట్ ఎవర్.
Hi, this is Dr. Manisa Reddy. Today we have Dr. Anirud, interventional neurologist and stroke specialist. Let's welcome him. Thank you for joining us, sir.
Thank you.
How are you?
I'm good. How are you?
I'm good, thank you.
Yeah.
వెయిట్ గెయిన్ అయినప్పుడు జనరల్గా బ్యాక్ పెయిన్ వస్తూ ఉంటుంది, స్పైన్ మీద కూడా పడుతూ ఉంటుంది ఎఫెక్ట్. స్పైన్ మీద కాకుండా ఈవెన్ బ్రెయిన్ స్ట్రోక్ వచ్చే రిస్క్ కూడా చాలా వరకు ఉంటుందంట.
Yeah, so as I told, weight gain means fat accumulation all over the body. And when there is more fat accumulation, especially abdominal fat, then there is more inflammation. Inflammation అయినప్పుడు whole body is inflamed. Our inflammation spreads to your blood vessels. Blood vessels are the ones which take blood to your brain. బ్లడ్ వెసల్లో ఇన్ఫ్లమేషన్ వస్తే అవి బ్లాక్ అవుతాయి, బ్లాక్ అయితే స్ట్రోక్ వస్తుంది. సో దట్స్ హౌ ద చైన్ ఆఫ్ ఈవెంట్ గోస్. వెన్ యూ స్టార్ట్ డూయింగ్ ఎక్సర్సైజ్, యూ స్టార్ట్ డూయింగ్ డైటింగ్, యూ లూజ్ యువర్ వెయిట్, యువర్ ఇన్ఫ్లమేషన్ కమ్స్ డౌన్, బ్లడ్ వెసల్లో ఉన్న ఇన్ఫ్లమేషన్ స్వెల్లింగ్ కమ్స్ డౌన్ అండ్ యువర్ బ్లడ్ ఫ్లో ఇంప్రూవ్స్. వెన్ యువర్ బ్లడ్ ఫ్లో ఇంప్రూవ్స్, నాట్ ఓన్లీ మనకి స్ట్రోక్ రిస్క్ తగ్గుతుంది, స్ట్రోక్ ఈవెంట్స్ కూడా తగ్గుతాయి, ఓవరాల్ బ్రెయిన్లో బ్లడ్ ఫ్లో ఇంప్రూవ్ అవుతుంది అండ్ యూఆర్ మచ్ మోర్ యాక్టివ్. That's why when you do in gym, when you go to a yoga class or some exercise, your blood flow you feel more energetic. What is that energy? That energy is this: your blood flow in the body has improved, inflammation has come down. So inflammation is basically when you have viral fever. ఎట్లా అనిపిస్తుంది మనకి? వీక్గా, డల్గా, నో మోటివేషన్, యూ డోంట్ ఫీల్ లైక్ డూయింగ్ ఎనీథింగ్.
సమ్ ఫీల్ ఈవెన్ బ్రెయిన్
ఫాగ్ ఉంటుంది, మలేజ్. వాట్ ఈస్ దట్? దట్ ఈస్ ఇన్ఫ్లమేషన్. సో వాట్ డస్ వైరల్ ఫీవర్ ఆర్ ఎనీ ఇన్ఫెక్షన్ కాజ్? ఇన్ఫెక్షన్, వైరల్ ఫీవర్ attacks your body. Your body reacts by trying to kill them. How does it kill? It sends inflammatory cells, inflammatory chemicals or markers, whatever you say. And when that inflammatory marker level increase అయినప్పుడు body also feels the effect. ఓకే, సో యూ ఫీల్, దట్స్ కాల్డ్ మలేజ్. జ్వరం వచ్చి ఒక రోజు ముందు ఉంటుంది మనకి, అలసిపోతాం, నొప్పిగా ఉంది, ఏం చేయాలనిపించలేదు, యూ డోంట్ నో వై, బాగానే ఉంది కదా, సడన్లీ ఏమైందని. దట్ ఈస్ కాల్డ్ మలేజ్. దట్ ఈస్ ఎగ్జాక్ట్లీ వాట్ ఇన్ఫ్లమేషన్ ఫీల్స్ లైక్. సో ఇఫ్ సమ్మన్ ఆస్క్స్ యూ వాట్ ఈస్ ఇన్ఫ్లమేషన్, హౌ డస్ ఇట్ ఫీల్, జస్ట్ ఇమాజిన్ ద డే ఆఫ్ ఫీవర్, 1 day before ఫీవర్ ఎట్లుంటుంది మనకి. సో దాట్ ఈస్ వాట్ ఇన్ఫ్లమేషన్ feels like. And our weight gain walla, lack of exercise walla, or overeating walla, that's how you feel. Many times we eat so much, biryani dine, ratri, how do you feel? You don't feel good. When you overeat, how do you feel? You
next minute you don't feel like moving at all.
You feel dull, you feel by endu dinna, tomorrow, next day also you feel dull and lethargic. No motivation, energy undadu body lo. But the day you go to gym,
we feel that
you feel active. That is the what you call reduced inflammation and increased blood flow in your body and brain. So just imagine one scenario where you are overeating, you are overweight, there is no exercise, no gym, you are perpetually in a state of malaise. Eppudu malaise lo untaru, years and years. Second scenario is you are eating correct
right food,
you're doing gym. Not only is your exercise reducing your weight and inflammation, it itself releases certain chemicals which improves your mood, which improves your energy levels, brain vitality and all those things. So that's second scenario. So it's very simple. Which person will be healthier?
Definitely the one who choose the
and which person will be more productive,
healthy,
more person, useful to the society, to the family and to themselves, So that's, and sometimes when people who go to gym regularly, they miss a day, they feel incomplete.
True.
That
ఆ guilt ఉంటుంది.
a guilt ఉంటుంది, and you feel. So what happens is, it's like, when you were kids, you don't go to play. ఆడుకోవడం పోవాలి, పోనీట్లే పేరెంట్స్. హౌ డూ యూ ఫీల్? యూ ఫీల్ రెస్ట్లెస్. బట్ పోవాలి, యూ ఫీల్ సంథింగ్స్ మిస్సింగ్. సేమ్ థింగ్ హ్యాపన్స్ విత్ జిమ్. వెన్ యూ గో టు జిమ్ రెగ్యులర్లీ, యూ మిస్ వన్ డే, అబ్బాయి వాళ్ళు పోలేదు, సమ్ ఇన్కంప్లీట్నెస్, హ్యాపీనెస్ ఉండదు.
I can feel it.
You can feel it, no? And so that's how good gym is. And one of the main reasons for depression. So these are all stroke and big things. Depression is something which
No,
you feel.
once you start hitting gym, no more depression.
No depression. So I tell a lot of people who are depressed, they come and sit in the OP, they're like this, dull and tired, thin, no muscle mass.
Okay.
Belly fat, no muscle mass, dull face, bent posture, sitting like this, dullness on the face. Why? Because of this, no physical activity. You're sitting all day, you're eating all day, you're not doing any exercise. How are you going to feel healthy?
True.
There's no motivation. Any person comes to depression, I tell them, please go to gym. Please do some swimming. Please do some cycling. Running is so uplifting.
True.
That I think sometimes
It
more than
shakes
gym,
off, like, literally
more than
over-
gym, running is so addictive. You start running, initial 1 or 2 rounds, you feel, you're tired, you're stiff. But by the 4th or 5th round, you don't want to stop.
True.
And because you have to go to work and people are calling at home, you're going. Otherwise, you feel like running. You feel really, that mood elevates. That, and many times evenings when I come back from hospital, if your mood is low, you go to gym, you are like a different person.
That shift is different.
So the cheapest way of treating your depression, keeping yourself healthy.
Even depression, anxiety, everything
goes. Amni bote, and you feel confident.
True.
You feel confident.
Yes.
So these are simple remedies.
అయితే కొందరు క్రాష్ డైట్స్ కూడా ఫాలో అవుతారు. సో అది నిజంగా హెల్ప్ అవుతుందా?
See, no, I really don't recommend. I strictly tell my patients, crash diets or any kind of plan which drastically changes your diet habits.
In short span.
In a very short span, drastically changes. And suddenly you're from eating proper idli, dosa, annam, pappu nunchi, you're eating salads, boiled vegetables and soups and green teas. You are definitely going to get in trouble. And I've not seen anyone who, maybe initially you will feel there's a weight loss, but again, it's not a sustainable thing. It is not.
In a month or two, they come back.
You cannot sustain it. No? I have seen so many patients. Initially, once I had a stroke patient, old person. They got discharged. Then I told them, improve your diet, eat good. All. The kids took him and put him in some place which has a strict dietary this thing. 3 months later, he comes and he's dull, he's weak, he has dark circles, he's depressed and frustrated. What happened? They don't let me eat. His complaint was that he's hungry and that diet nonsense is there, like, you can't eat this much, you only have to eat this much, only at this time. It's not practical, it's not sustainable. It is how and you're
and every individual cannot sustain that.
You cannot sustain. Some people eat very less by nature, by their body. Its makeup is like they eat less. That's different. Just because it works for someone, it doesn't mean it will work for everyone.
True. And మీ దగ్గరకు వచ్చి పేషెంట్స్ జనరల్గా కూడా ఎట్లా ఉంటారంటే, పేషెంట్ ఏం లేదమ్మా అన్నీ తినొచ్చు, కాకపోతే లిమిట్లో వెన్ యూ సే నో దిస్ సరిగ్గా చెప్పట్లేదు అని దే ఫీల్ ఇట్ దట్ ఇస్ ద పాయింట్, దే గో అండ్ జాయిన్ సమ్వేర్ ఎల్స్.
దిస్ ఫుడ్ ఫ్యాట్స్ ఉంటాయి కదా, వేర్ you drastically change something, I've never seen it ending well. It's some way that something happens with salt ban chestaru, they come back with hyponatremia, low sodium, and they end up in ICU. They completely stop eating any kind of fat. Any kind of fat. Oil, you need oil in your body. If you don't have oil, how can you have dry food?
True.
You need oil in your oil, reduced amount, not absolute absence of oil.
మొత్తం అది సిస్టమ్ ని మొత్తం పాడు చేస్తుంది.
We started our MBBS and our biology in school with 70% carbohydrate, 20% protein, and some 10% fat. It has become ulta now. You eat now 0% carbohydrate, 90% protein. So that's not working. So balanced diet definition has changed. And I don't know how this thing is coming up, people are accepting it slowly, but as doctors and what we read in biology, this is what a balanced diet is.
No, but that is somehow affecting on our, digestive system also. Without any fat, how come, everything itla process
yes, you need lubrication. These things might seem very unscientific, this terminology that you have to eat fat to have lubrication and you need oil in your body. But then you have fat in your body, right? You have fat under your skin and your abdomen.
True.
Fat is not bad. You need fat in your body. Adipose tissue, it helps in insulation, it helps in giving stored energy when you require and all. The point of our life is not to have no fat. Quantity matters. కొంచెం fat ఉండాలి, protein ఉండాలి. So a balanced diet gives you. So thing is, food fats the problem ఏంటంటే when you stick to one type of food, you end up invariably having some deficiency of something else. So your purpose is to reduce complete carbohydrates, not eat sugar, not nothing, but then you end up having some other this
True.
thing.
అయితే మీరు చూస్తూ ఉంటే జిమ్కి వెళ్ళే వాళ్ళు చాలా మంది ప్రోటీన్ ఇంటెక్ చాలా వరకు తీసుకుంటారు. సమ్వేర్ ఫైబర్ లాస్ ఉంటుంది, దానివల్ల దే హ్యావ్ కాన్స్టిపేషన్, సమ్ ఆర్ ది
యాక్నే ప్రాబ్లం అవుతుంది, కాన్స్టిపేషన్, గ్యాస్ట్రైటిస్ అవుతుంది.
జిమ్కి వెళ్తున్నా నేను అయినా హెల్తీగా ఉండట్లేదు. దిస్ ఇస్ వాట్ ఇస్
బికాజ్ యు ఆర్ పంపింగ్ యువర్ బాడీ విత్ కెమికల్స్.
And protein annappudu they don't take natural protein.
We have so much protein in our food, even vegetarian diet.
True.
I myself calculated once.
Okay.
I'm having vegetarian diet. How much protein am I taking in a day, including breakfast, dosa, idli, lunch, dal, and I was going up to around 60-70 grams per day with normal diet, without any protein shake, without eggs, without other stuff. Still it's going 60-70. Why do you need so much of pumping of artificial protein?
True. Kidneys మీద కూడా ఎఫెక్ట్ పడుతుంది అని రీసెంట్ టైమ్స్.
కిడ్నీస్ మీద ఎఫెక్ట్ పడుతుంది. And see, ultimately these are all processed foods. I am not a big fan of processed foods. Whether it is butter, whether it is chips, or any Maggi, all these are processed foods, and by definition processed foods tend to remove certain things from the food which we are unaware of. Chine fresh homemade food lo, there are many things which we count and carbohydrates, protein ani maatladtam, but there are other things which we don't know which actually give us nourishment. So when you eat processed food, all that is not there.
True.
So we need to eat fresh food, try to include natural food with whatever requirement you have, and that keeps your body healthy in a natural way. And you will not have problems like this.
True. సో జనరల్గా మన పాడ్కాస్ట్ చూస్తున్న వాళ్ళకి ఎవరికైతే అవేర్నెస్ లేదో అన్నీ హెల్దీయే, కాకపోతే ఏది కరెక్ట్గా ప్రాపర్గా ఎంత క్వాంటిటీలో తినాలి అనేది ఐడియా ఉండదు. సో అట్లాంటి వాళ్ళకి లైక్ న్యూరో హెల్త్ కోసం కానీ స్పైన్ కోసం కానీ బాగుండాలి అంటే ఎట్లాంటి ఫుడ్ తీసుకోవాలి?
సో మోస్ట్ ఇంపార్టెంట్ nowadays B12 is a very vitamin B12 people have become aware of how it affects neuro. So and with that there's one more small thing that vegetarian diet does not have B12 అని కూడా ఉంటుంది. But we have seen so many vegetarian people, lifelong vegetarian people who have done really well, who are cognitively, mentally, physically very fit, don't have memory loss or dementias, anything. So I don't think it is a problem of, if you're having a balanced diet, veg, non-veg, whatever, then it's fine. If you're having some kind of fat diet like vegan or I will not have this at all, then it might be a problem.
Okay.
But a balanced diet, I think B12 is there in sufficient quantity, like curd, milk, dry fruits, paneer in vegetarian diet. Non-veg lo egg, chicken, meat, meat lo baane untundi. Even dry fruits have a lot of this thing. Curd has many, milk product has enough B12. Okay. So all these have B12. The problem comes is when you have lack of absorption. So because of any reason, whether you're having processed food, you have gastritis because of alcohol or smoking or black coffee, whatever reason you have gastritis and that is causing lack of absorption of B12, then you end up having B12 deficiency. Right? So problem of B12 deficiency, especially if you have a severe deficiency and recurrent deficiency, malli ఒకసారి తీసుకున్న ఇంజెక్షన్ 1 year తర్వాత మళ్ళీ తీసుకుంటున్నారు అంటే it is, unless if you're having good diet, then problem is absorption.
Okay.
So then you have to get your gut checked. Many of these people who have B12 deficiency have irritable bowel syndrome or some kind of minor form of celiac disease where there is gluten sensitivity, or for some other reason they have atrophic gastritis.
Okay.
And that causes reduced absorption of B12. So you need to, if you have symptoms, so any B12 deficiency person that comes, I always ask them, how's your gut? Do you feel indigestion, frequency of stools? You have frequent feeling of bloating, belching and pain after eating food. So that can be because of some ulcer or some gastritis.
Okay.
And do you have any allergy to certain kind of food that you as soon as you eat you have stomach pain? So all these are things which are suggestive there is a primary issue with the gut which is causing malabsorption of nutrients, and then you end up having vitamin D, vitamin B12 deficiency and all. And when your gut is not healthy, your mind is also not healthy.
Definitely.
Yeah, so you must be seeing, constipation causes irritability. If you are having stomach pain, gastritis, again you are confused, and
You don't have that energy to think also.
And so if your gut is not healthy, your brain is not healthy. That is very, very important. So you always look at the main reason why you're having the issues.
సో ఎప్పుడు ఒకరు లైక్ నెక్ పెయిన్ కానీ బ్యాక్ పెయిన్ వచ్చింది అనుకున్నప్పుడు ఇది నార్మల్ కాదు, దిస్ ఇస్ అ రెడ్ ఫ్లాగ్ ఎమర్జెన్సీ అని అనుకోవాలి.
So see, neck pain and back pain is a what we feel కదా. సో అక్కడ మల్టిపుల్ స్ట్రక్చర్స్ ఉంటాయి. నెక్లో యూ హ్యావ్ నర్వ్స్, యూ హ్యావ్ బోన్, you have muscle, and you have other fat tissues. So any of these things can give you pain.
Okay.
So most commonly you don't sleep properly, you have a muscle stiffness, back stiffness, and you have pain. So that is mostly because of some mild muscle spasm.
Okay.
That is not a problem. Then second, maybe severity you can say, is సివియర్ పెయిన్ వస్తుంది. సివియర్ పెయిన్ వస్తుంది అండ్ తగ్గట్లేదు, చాలా రోజులు ఉంది, అండ్ ఇట్ డజంట్ ఫీల్ లైక్ స్టిఫ్నెస్. There is something called neck and back stiffness, and there is something called stiffness ఎక్కువ లేదు కానీ లోపల డీప్ బోరింగ్ సివియర్ పెయిన్ ఉంది. That is probably a bone pain. So there is something wrong with the spinal vertebra.
Okay.
Infection undo, lepas some mass undo, some swelling undo, then you have to check that. Third is when your nerve gets compressed, that is a different kind of pain.
True.
That is called radicular pain antaru danni. So I'm just trying to explain what are the different kinds of pain, because pain is not enough. So radicular pain is where you feel a very sharp pain which radiates to a different area. ఇక్కడ వరకు వస్తుంది, లాగినట్టు ఫీలింగ్ అంటుంది, పారుతున్నట్టు ఫీలింగ్ అంటారు, చేయి మూమెంట్ చేసినప్పుడు తిమ్మిర్లు వస్తున్నాయి, నమ్నెస్ వస్తుంది, ఆర్ పెయిన్ ఎక్కువ, తుమ్మినప్పుడు దగ్గినప్పుడు గట్టిగా జర్కీ మూమెంట్ ఉన్నప్పుడు షూటింగ్ పెయిన్ వస్తుంది.
ఓకే.
This is all called radicular pain, where this is a sign of nerve getting compressed, and the nerve gets compressed, you have a very shooting sharp pain which radiates to a different part of the body, either lower back నుంచి లెక్కి sciatica అంటారు, cervical నుంచి చేతికి వస్తే cervical radiculopathy అంటారు. So that is nerve pain. So if you have such symptoms, that means whatever is causing the pain, it is compressing your nerve. Then that is a problem, because nerve gets compressed. Initially it will be only radicular pain, second will be numbness and tingling, and third will be weakness of arm or muscles. So that has to be taken care of. Then you have to definitely get a scan, most importantly, or preferably MRI scan, because MRI is the only one will show both nerves and muscles and everything. CT will show only bones.
Okay.
So in such cases I simply ask, if you have neck pain, జస్ట్ స్టిఫ్నెస్ ఉందా, ఏమైనా చేతికి రేడియేట్ అవుతుందా, తిమ్మిరు ఉందా అంటే మాత్రం ఇట్ మీన్స్ దెర్ ఈస్ సమ్ కైండ్ ఆఫ్ నర్వ్ కంప్రెషన్, యూ గెట్ ఎన్ MRI.
అయితే యంగ్స్టర్స్లో లైక్ ఈవెన్ ఇన్ 20s and 30s ఉన్న వాళ్ళకి కూడా ద నర్వ్ ఇస్ గెటింగ్ కంప్రెస్డ్.
Yes.
సో సర్వైకల్గా ఉన్నప్పుడు వెన్ అ పేషెంట్ కమ్స్ టు యూ, యంగ్గా ఉన్న వాళ్ళకి ట్రీట్మెంట్ విధానం ఎట్లా ఉంటుంది, ఫస్ట్ లైన్ ఆఫ్ ట్రీట్మెంట్, అండ్ వెన్ ఇట్ ఈస్ అడల్ట్స్ ఎట్లా ఉంటుంది? బికాస్ ఎందుకు అడుగుతున్నానంటే, వెన్ ఐ హర్డ్ ఫ్రమ్ సమ్ వన్, యంగ్గా ఉన్న వాళ్ళకి ఏం చెప్పారంటే, యూ కెనాట్ గో ఫర్ సర్జరీ, యువర్ లైఫ్ స్టైల్ హ్యాబిట్స్ హ్యావ్ టు చేంజ్, ఎక్సర్సైజ్ చేయండి, ఆర్ ఎల్స్ ఫర్ ఫ్యూ డేస్ మందులు ఇస్తారు. సో వాట్ ఈస్ యువర్ ప్లాన్?
So see, age has nothing to do with it. See, it all depends on what is exactly happening.
Okay.
The process of the pathology. Neck pain, back pain is just address of the pain. Pain ekkada undi. That is anatomical diagnosis. Neck lo pain undi. But exactly what is happening? Just neck spasm unda, lebothe disc mottam bayitiki vachesi nerve complete compress chestunda. There is something called acute disc bulge antaru. Sometimes they fall or they go to gym and lift a heavy weight. The disc pops. ఇట్లా పక్కన పాప్ అయిపోయి మొత్తం బయటకు వచ్చేసి కంప్లీట్లీ కంప్రెసెస్ ద నర్వ్. దెన్ దే హ్యావ్ సడన్ అక్యూట్ సివియర్ పెయిన్ విత్ ఇన్ లైక్ 2-3 days, అండ్ దెన్ దేర్ ఈస్ సమ్ టింగ్లింగ్, నమ్నెస్ అండ్ ఆల్. దాట్ ఏ ఏజ్ అయినా యూ నీడ్ టు బి కరెక్ట్, ఇట్ హ్యాస్ టు బి కరెక్టెడ్ త్రూ సర్జరీ. That is very simple. Okay, so that's why it's important to understand the process. It is not a straightforward answer. Okay, sometimes what happens, pain is there for a long time. Disc is like really మొత్తం డిస్క్ బయట ఉంది, it's really compressing the nerve, but there are no symptoms of nerve compression.
ఓకే. నో పెయిన్, సెన్సేషన్.
మైల్డ్ పెయిన్ ఉంటుంది కానీ దిర్ ఇస్ నో రాడిక్యులర్ పెయిన్, నో సెన్సేషన్ లాస్, నో వీక్నెస్. వై? బికాస్ ఆ డిస్క్ చాలా నుంచి బయట, డిస్క్ ఇస్ లైక్ అ పేస్ట్, టూత్ పేస్ట్ ఉంటుంది కదా, ఆ కన్సిస్టెన్సీ ఉంటుంది సమ్ టైమ్స్
ఓకే.
ఫ్రెష్ డిస్క్ ఉంటే. దాట్ క్యాన్ come out, that sometimes it does not compress the nerve. So then we can wait and watch. Sometimes because it gets reabsorbed. The body sometimes reabsorbs it, so it might not require surgery.
Okay.
But it all depends on the symptoms. Meeku pain to paatu nerve compression symptoms unnayi ante you get an MRI. Dantlo yes, you confirm that this is because of a disc bulge which is causing this. It is a mechanical problem. Disc nerve compress చేస్తుంది, nerve problem వస్తుంది, తీయాలి అంతే. There is no question over it.
Okay.
Very rarely, sometimes some people with medications might improve, but it's a risky thing. People who are very old, debilitated, they cannot withstand the surgery. Atlanti vallaki మనం sometimes we give medical treatment and wait and watch.
Okay.
But young or old, nothing, especially actually as a matter of fact, young patients should be more proactive, because they have so much of productive life. You cannot have a not working hand or numb hand. So it is all about how much disc is bulging and how much is the nerve symptoms.
అయితే ఇందాక అన్నట్టు సమ్ టైమ్స్ ఒక్కొక్కసారి అబ్జర్వ్ చేసుకోవచ్చు, ఇట్ కమ్స్ బ్యాక్. అట్లా కూడా జరుగుతుంటుందా? ఒక నర్వ్ కంప్రెస్ అయ్యి వన్స్ ద డిస్క్ ఇస్ అవుట్, కెన్ ఇట్ గో బ్యాక్ టు నార్మల్?
Yeah, so that can happen.
Okay.
That will happen. If you don't do surgery, ultimately the disc will get absorbed. But the question is, how long will that take? Right? And in that period, will your hand survive?
Okay.
Adi, for example, a patient comes with mild pain, mild tingling. Koncham tingling untundi, and there is some disc bulge. We will tell them, fine, koncham disc bulge undi, we'll give you medicine. Over few days or weeks, the pain subsides, tingling goes, the disc gets absorbed over next few months. No problem.
Okay.
What if the same person comes with complete numbness of one hand and hand grip weakness? Do you want to wait for few weeks?
No.
Is it a few weeks to disc లోపల పోయేసరికి చేయి పడిపోతుంది.
Okay, that also
See, so that it also depends on that, I told you, symptoms. So the severity of the symptoms, whether, see, because once a nerve gets compressed, you don't have much time. 48 hours లోపల చేయకపోతే, lower back అయినా upper back అయినా, 48 hours లోపల if you do not decompress the nerve, the disc, the nerve is dead. It's not going to come back. You 3 weeks are తగ్గలేని చేయించుకుంటే తగ్గదు అది. So this is the most common scenario where many neurosurgeons feel that patient should have been sent to them before.
Okay.
Because pain and tingling అని వస్తారు, మందులు రాసి పంపించేస్తారు, 2 weeks 3 weeks అది వస్తారు, తగ్గదు. ఆ టైంలో సర్జరీ చేసినా అమ్మ లాభం ఉండదు, చేస్తాం కానీ చేసినా కూడా లాభం ఉండకపోవచ్చు అని చెప్తారు. వై? బికాజ్ టైం అయిపోయింది.
Okay.
సో symptom onset appudu you have to make a proper call. All patients should not be given an option of surgery, I agree, but at the same time all patients should not be given an option of wait and watch. You have to see patient to patient basis. Severe symptoms unnai ante, young patient severe symptoms cheyi pani cheyatledu ante, you have to go for it. You have to decompress. You cannot
Because
wait.
here మీరు చెప్పినది చూస్తే both should be more of ఇద్దరికి అవేర్నెస్ ఉండాలి, ద డాక్టర్ అండ్ ఈవెన్ ద పేషెంట్. సమ్టైమ్స్ ఎందుకంటే ఈవెన్ ద డాక్టర్స్ ఏం లేదు, వేసుకోండి, మెడిసిన్స్ వేసుకోండి, తగ్గిపోతే సర్జరీ చేయలేము అని అంటారు. యాజ్ యూ సెడ్, లేదు మీరు ఇందాక అన్నారు కదా, ఇమీడియట్లీ కొన్ని అవసరం పడుతుంది, బికాస్ నర్వ్ డజంట్ కమ్ బ్యాక్. అట్లాంటి సిచ్యువేషన్స్లో we cannot
I know. So once the nerve is gone, it's gone. It's brain lo stroke ade problem. You open it up quickly, the nerve improves, fine. Nerve lo spine lo compression ade problem, kaalo compression ekkadunna vada nerve gets damaged. If you're able to remove the damaging or attacking factor within few days, that's okay. Otherwise it's gone.
Okay.
So nerve is not like other cells in the body.
So what exactly is a neurointerventional generalga meer chesedi, and how is it different from open surgery?
Okay, many times people have a confusion between what is neurosurgery, what is neurophysician, what is neurointervention. So just to clear basics, so when you finish MBBS, we all choose whether we want to go on a surgical side or a medical side.
Okay.
Surgical side ante any organ, brain, kidney, heart, whatever, if you are predominantly treating them with surgical skills or surgery, then you become a surgeon in that field. Neurosurgeon, cardiovascular surgeon, neurologist ante kidney neurology. Medical, when you treat most of them with medical medicines without doing surgery, you're a physician. So these were the basic distinctions maybe 50-40 years back. Then as advances came, we were able to do certain procedures through wires or minimal access surgeries antar kada. Endoscopy is one. Neuro intervention where you do catheter based through angiography or blood vessels. Heart ki manam angioplasty, angiography chestam. Heart ki surgery cheyochu, opens heart surgery, and same thing angioplasty కూడా చేయొచ్చు through wires.
True.
So that is called intervention cardiology. Same thing if you do in brain, it's called intervention neurology or neuro interventions. Okay. So when you have only medical treatment, other end you have surgical open treatment, and in between you have minimal access surgery. One of the minimal access surgery techniques is catheter based neuro interventions.
Okay.
So in that what happens is mainly the diseases which we treat in neuro intervention are blood vessel based, where you have stroke because of block of an artery. You go through the artery tube and you just bring out the clot. You have an aneurysm in the brain, small outpouching artery low, then you go in through the artery, you coil it or put a stent there and close it.
Okay.
Or you have an AVM where there is some blood vessel abnormalities, you embolize and block it. So mainly neuro interventions right now are all blood vessel based, wherever blood flow issue is there. Recently, certain other techniques are coming where you can do other minor surgeries like VP shunt,
Okay.
or SDH drainage. అంటే sometimes brain లో బ్లీడింగ్ అయిపోతే దాన్ని డ్రైన్ చేయడానికి బర్ హోల్స్ అని పెడతారు, మీరు ఉంటారు. ఇక్కడ ఇంజరీ అయిన తర్వాత పడిపోయిన తర్వాత there is some bleeding between the brain covering and the bone. Or brain or the covering of the brain మధ్యలో, not inside the brain, outside the brain and between the bone. అట్లాంటి situations లో neurosurgeons used to do a burr hole where they put a hole and drain the blood. Now new techniques is coming where they go through the arteries and put a small puncture and put a catheter there and drain it through the blood vessel itself without opening the bone at all.
అంటే ఓపెన్ సర్జరీ
లేకుండానే you can drain it. So these are new techniques which are upcoming. And there are something called VP shunt, when there is fluid in the brain and brain becomes swollen and big, you put a small tube, it's called VP shunt.
Okay.
Where it goes from the brain to the stomach and it drains the fluid. That also is a kind of open surgery. That also there are some new techniques which can be done through catheter based blood vessel access. So as advances progress, more and more things will come into minimal access rather than open surgery. So this is called neuro intervention.
Okay. సో మీరు ఇది చెప్పండి, ఇస్ ఇట్ అ మిత్ ఆర్ అ ఫ్యాక్ట్? జనరల్గా బ్యాక్ పెయిన్ ఉన్న పేషెంట్కి కంప్లీట్ బెడ్ రెస్ట్ అంటూ ఉంటారు. అదే హెల్ప్ అవుతుంది అని అంటారు. ఇస్ ఇట్ అ మిత్ ఆర్ అ ఫ్యాక్ట్?
See, it is definitely useful in majority of cases. Being a neurophysician, we always offer, unless there is acute symptom and we send ki surgery 100% avsaram. Ledante always with medicines, I always tell them, if you take medicines and you do not take bed rest, then you're wasting your medicines and time.
Okay.
Why bed rest is important is as simple as this. You have a small injury on your hand, okay, and you daily get up in the morning, evening, you keep hitting it. Will it reduce? తగ్గదు. ఆ స్వెల్లింగ్ అట్లే ఉంటుంది. రోజు దాన్ని కొడుతుంటే ఎక్కడ తగ్గుతుంది అది? సో వాట్ ఎగ్జాక్ట్లీ హ్యాపన్స్ ఇన్ స్లిప్ డిస్క్ ఇస్, a disc is supposed to be this far away from now. Just give an example. In a slip disc, the disc clips and comes like this. Okay. Now in certain positions, either during bending forward or lifting a weight or sitting in a car or a bike or sitting on a chair, that position of the disc and nerve changes and the disc compresses the nerve. Normally, if it was this far, whether you bend or you jump or you do somersaults, it will not touch. So there will not be any pain. But in this situation, because it's so close, any change in position will touch. Then the disc will touch the nerve and you will have pain.
True.
So that is why you advise bed rest. Because when you're sitting or standing or in any erect posture, your spine is under stress. Weight పడుతుంది కదా, బాడీ వెయిట్ పడుతుంది, గ్రావిటీ ఉంటుంది, you move. So your spine is not under full rest.
True.
So there's always a possibility of that thing touching your this thing. When you lie down, the weight of the gravity effect is completely gone from the spine. Your spine is completely at rest. In such situations, it might the compression will reduce. So that's why we say you take complete bed rest as much as possible, depending on your lifestyle and your family situation, with the medication. So you're what medication you're giving? Basically, you're giving one painkiller. Painkiller is not only a painkiller. I'm I want to use this platform to say, painkiller, people think pain లేదు ఎందుకు తీసుకోవాలి తగ్గిపోయింది. Painkiller, they are called NSAIDs. Okay. NSAIDs, they work by reducing the inflammation, which gives pain. It is the inflammatory markers which give you pain. So and damage the nerve or muscle, whatever it is. So what exactly happens? There is an injury. That injury valla inflammation పెరుగుతుంది. Inflammation valla pain receptors activate అయితే, and then you get pain. So when you are giving a medication which stops this inflammation, not only are you stopping the pain, you're also stopping the damage being done to the body. Right?
True.
So painkillers have two effects: reduce the pain and reduce the ongoing damage. Okay. So it is not that they are just not symptomatic treatment kaadu avi. So many patients who have swelling in the knee or ankle, వాళ్ళకి పెయిన్ కిల్లర్ ఇస్తే స్వెల్లింగ్ కూడా తగ్గుతుంది. పెయిన్ ఒకటే కాదు, మెనీ ఆర్థోపెడిషియన్స్ గివ్ ఓన్లీ NSAIDs ఫర్ పెయిన్ కిల్లర్. స్వెల్లింగ్ కూడా తగ్గుతుంది, రెడ్నెస్ తగ్గుతుంది, స్వెల్లింగ్ తగ్గుతుంది, అండ్ పెయిన్ తగ్గుతుంది. సో దీస్ ఆర్ ఆల్ పార్ట్స్ ఆఫ్ ఇన్ఫ్లమేషన్. Pain, swelling, redness, all these are parts of inflammation. The 4-5 things are there. So this NSAIDs blocks all 5. So painkillers are given for both this purpose. Second, sometimes we give some low dose steroid to reduce the inflammation, which has again the same effect as NSAIDs, but slightly more effective. Some antacids to reduce the effect of these medications on gut. And sometimes if there is a nerve compression, you give certain tablets like gabapentin or pregabalin, which reduce the nerve hyperstimulation. ఇప్పుడు nerve compression అయినప్పుడు nerve pain వస్తుంది కదా. సో ఆ తగ్గడానికి we give this medication. So gabapentin, pregabalin, which are very common, everyone knows. gabapentin అందరూ తెలుసు ఇప్పుడు. So what that does is it reduces the nerve pain. So these are the group of medications which you usually give for lower back pain or upper neck pain. దీంతో పాటు if you don't take rest,
nothing is helping.
Pain will reduce అంతే కదా. మీరు
that also మళ్ళీ ఎక్కువ రోజులు it won't be helping them. Rest లేనప్పుడు nothing will help.
It will not help. That's why I say you take this medication for a week, you do complete bed rest, you do a complete holistic treatment for this, and some physiotherapy and hot fermentation with that to reduce the muscle spasm, then you will be fine in a week.
True.
Other than that, instead of that, you take medication for a week, then
nothing
you will not take rest, then you next week you say again so that will prolong to 3 weeks, 4 weeks, 5 weeks.
True. And pain ఇంకా double అయ్యి వస్తుంది
and తగ్గదు. And sometimes the worst part is sometimes when you these conditions initially, if you're able to treat them aggressively, properly, the pain subsides. Otherwise they become chronic.
True.
అది ఇక నడుస్తూనే ఉంటుంది, పెయిన్ ఎప్పటికీ తగ్గదు.
అట్లాంటి పేషెంట్స్ని మీ ఎక్స్పీరియన్స్లో మీరు చూసుంటారు కదా, చెప్పినా వినకుండా దే డోంట్ టేక్ రెస్ట్, నీడ్ ప్రాపర్ మెడికేషన్ కానీ ప్రాపర్ లైఫ్ స్టైల్ మెయింటైన్ చేయకుండా దే రిగ్రెట్ ఇన్ ద ఎండ్. అట్లాంటి పేషెంట్స్ ఉన్నారు మీ దగ్గర?
సో last year when I was in Delhi for a few months, I was working in a hospital there. There one staff he was a little obese, short, and he was like a body type who was prone to having slip disc. Okay. And he had a slip disc 1 year back also. He had some pain and all. Medications were given, surgery was advised. He did not take it. So that day he suddenly came to my cabin on a wheelchair. He came on a wheelchair. Okay. And what happened, he was lifting a 25-liter water can. He's a known case of slip disc, severe slip disc, back pain, surgery already advised. He did not go for surgery, was advised not to do all this heavy lifting. He did not listen. That day he came on a wheelchair. That day he got the MRI done. I saw the MRI. I told him, see, this disc is like really out. Manchi compressed చేస్తుంది. And you yourself have come in a wheelchair. You're not able to walk. You're not able to lift your leg. Please go for surgery immediately. As a neurophysician, I told him, this is no doubt that you need surgery. He waited for 6 days.
After that also
he waited for 6 days. 6 days తర్వాత మాట్లాడి ఆ విషయాన్ని డిస్కస్ చేసి సెకండ్ ఒపీనియన్, థర్డ్ ఒపీనియన్, ఫోర్త్ ఒపీనియన్ తీసుకున్న తర్వాత 6 days వరకు ఆ ఉన్న వీల్ చైర్లో ఉన్నాడు. ఆ కాలు మొత్తం అయిపోయింది. Then he underwent surgery. Now what will come back? 6-7 days తర్వాత when your leg, when he was at least able to move, I told him there is a right time to get it done. అప్పుడు కూడా చేయించుకోలేదు. మొత్తం పడిపోయిన తర్వాత చేయించుకుంటే ఇంప్రూవ్మెంట్ రాదని చెప్పాం. కంప్లీట్ పారాలిసిస్, లోవర్ లింబ్, 35-year-old man.
35 years.
35-year-old guy,
Okay.
worker in a hospital, and complete paralysis, not like mild one, both legs completely gone.
Oh.
So these are things which, as doctors, I always tell them from my side, see, all things aside, I'm telling you very clearly, this is a clear-cut case, requires surgery or neurointervention or this medicine, that medicine. Please do this. If you don't do this, you'll be in trouble. I'll tell them very nicely. Most of them listen. Some of them we cannot help.
True.
That is their, wish.
So generally, off stress, sleep and diet. Which one will be like, you feel like moving with the needle?
I definitely would say sleep. Because stress can be managed, if not now, tomorrow. Food can be changed, if not
True.
tomorrow, but you cannot go without good sleep for a long time. Sleep
True.
is the most important, and bad diet may kill you, but lack of sleep will kill you.
True.
There's no doubt about it. So most important is sleep, because if you don't sleep well, even if your diet is good, your lifestyle is good, and if you don't sleep well, you're not going to survive.
True. It helps you healing కూడా జరుగుతుంది కదా, back end
హీలింగ్
repair.
ఉంటుంది. అంటే మీరు ఏది చేసినా హీలింగ్ చేయకపోతే, మీరు హౌ మచ్ ఎవర్ వర్క్ యూ పుట్ ఇన్, ఇఫ్ యూ డోంట్ గివ్ ఇట్ ప్రాపర్ మెయింటెనెన్స్, ఇట్స్ లైక్ బేసిక్లీ బయింగ్ అన్ ఎక్స్ట్రీమ్లీ గుడ్ కార్. Extremely car, but you don't maintain it. It's not, you put petrol, you put diesel, you put E20, you put whatever, turbo, nothing's going to work if you don't maintain it. If you don't do servicing, you don't clean it, it's not going to work.
True.
So sleep is the most important.
So that's your message.
Sleep is the most important thing for your body.
Thank you so much for your insights.
Thank you.